What's up, everybody, and welcome to the Professional Athlete Podcast. For those who don't know, I am your host, Ken Gunter, and could not be more excited about the show that we had today. We were joined by sleep expert, Dr. Wendy Troxel, and we had a really, really interesting conversation. So she is a senior behavioral and social scientist at the RAND Corporation. She's also an adjunct professor of psychiatry and psychology at the University of Pittsburgh. She's a licensed clinical psychologist, and she specializes in behavioral treatments for insomnia and other sleep disorders. Her research focuses primarily on the interface between sleep and the social environment and health. And as a result, that actually ends up having a lot of implications on public policy. So she's considered a leading authority on how sleep affects and is affected by close relationships. So if you're a snuggler out there, be sure to listen up. This one's important. Dr. Wendy has been featured on CBS Sunday Morning, Good Morning America, The Wall Street Journal, The New York Times, MSNBC, CNN. She's been in numerous documentaries for National Geographic, and she's done a couple TEDx talks, the first of which is really interesting, and we're going to touch on that today. It's about adolescent sleep and the impact of school start times. And her most recent presentation was on the relationship between couples and sleep. Whew, that's legit, folks. So I wouldn't blame you if at home you were wondering, hey, Ken, your show's pretty new. Still kind of small potatoes. How did you get Dr. Wendy Troxel to come in studio and have this conversation with you? Well, first and foremost, she was very kind and gracious with her time, so super appreciative for her to sit down with us. But what was really wonderful is she's actually out visiting because she was at our local school district trying to educate our town on the impact that school start times actually has on adolescent sleep and the resulting consequences it can have for our teens. So huge implications in terms of what it'll do to their physical and mental development and their resulting mental well-being. So really, really important work being done. And we're grateful that she's getting out in the field and doing it here. And I thoroughly enjoyed the conversation. So on that note, if you're also enjoying the show, please do leave us a rating and a review. Can't thank all those folks who've reached out and given us feedback enough. We really appreciate it. And I do try and guide the show in terms of what I'm hearing is of interest. So please leave a review. Anything less than 5 stars, and safe to say my kids might not go to college. So do it for the kids, people. On that note, again, we have a fantastic show. So please welcome Dr. Wendy Troxel. Here we go.
I gotta get up. I got too much to do. Yeah, I gotta get going. I gotta talk to you. It's time to start the show.
So thank you for coming out.
My pleasure. It's fun.
I appreciate that. Yeah, like I was saying, sleep has just been such a huge point of emphasis lately. Not only because we just had a baby and like we're not getting much of it, but just like I was saying in general before we started, it's like I kind of identified that seemed to be like possibly the biggest link or the biggest weak link in my own life in terms of like where I was sacrificing energy. Mm-hmm. I kind of, not to like spill my guts here in the first 30 seconds.
I'm a clinical psychologist.
Okay, thank you. I appreciate that.
Lay down on a couch if you like.
No, but I kind of, and you talk about this in your most recent TED Talk that I was just watching, where there's this culture where we kind of hold up people who sacrifice sleep, right? It kind of becomes like this badge of honor to sleep less, work more.
Yeah.
And while well-intentioned, I was definitely buying into that. And like I just started like falling apart at the seams,
right?
You know? And so I was like, okay, something's out of balance here. And so one of the areas that I've really tried to pay attention to and I'm trying to learn more about, which is why I'm so excited to talk to you, is, what is the role sleep's actually playing in my life? And then like, why is it so important?
Yeah. Well, it's interesting. I think people who, try to optimize their health and productivity in lots of different ways, there's a lot of things that we can control, and, we can sort of, increase our athletic training and the quality of our training.
Right.
We can really focus on our diet and what we're putting in our bodies,
Yeah.
all these things. We can do meditation, and yet sleep is this one thing that we can control some of the behaviors around sleep, but what's most important, like I think because it's like a less active state,
Right.
and yet it occupies about a third of our lives, even like for people who are sort of obsessively inclined
Yeah.
towards health behaviors, sleep is the thing that gets the crunch, because it's like we can't like do something about it other than allowing ourselves the opportunity for it. And that's often exactly what we don't do, is we sacrifice the opportunity for it in lieu of the other activities that we're doing.
Yeah, it's like when a day becomes busy and you're trying to squeeze everything in, that feels like the space that you can start to like squeeze out.
Exactly. It's like the dead space, or that's how we
Exactly.
think about it.
Yeah, yeah.
Which couldn't be further from the truth.
Yeah. And so why is that? Like, I think people are becoming more aware, hopefully generally, as to the importance of sleep. But like when I talk to friends and family, I feel like there's still a huge gap in understanding like just what is the role that sleep plays kind of like within our own physiology,
Yeah.
like I guess like what is the purpose of sleep?
Yeah. Well, I mean, as a colleague of mine says, I mean, to ask the question, what's the purpose of sleep? It's like the equivalent of asking like, what's the purpose of being awake?
Yeah.
How can you distill something that takes literally 1/3 of our lives,
Right.
that actually is involved in every aspect of our physiology, from our immune system to our brain function to our hormones, everything you can imagine, to our mental health, how we think, how we behave, how we feel.
Right.
It affects so much. So how can you distill it down? To distill it down would be sort of to miss so much. And yet, I think we just come from this culture that, sleep science is a relatively young science. It's been around, 60 or so years. And culturally, I think we still have a lot of our, puritanical views of, up at dawn and,
Right.
work hard, and, that this, sleep is for the weak. So it takes a long time for the messages about the sort of pervasive impacts of sleep to sort of to really sort of trickle down and sort of get into our cultural awareness, and then
Yeah.
actually start changing behavior.
So that's actually an interesting point. So let me ask you this. So it's a relatively new field, which I guess in itself, understanding how important it is, right, is a bit shocking. So how did you actually get into the field of sleep research?
So I'm a clinical health psychologist by training, and I've always been interested in how and why relationships, how we're connected with others, how that might matter for our physical health.
Yeah.
And so a lot of my early work was focused on marriages or marital-like relationships, and why is it that married people, and particularly happily married people, live longer, happier, and healthier lives than their unmarried or unhappily married counterparts?
Yeah.
And there's lots of possible pathways that could explain that. And, some have more evidence for them than others. So things like, when you have a partner, you're more likely to, eat better, exercise. A partner is a powerful source of social control, meaning, helping you to do the good things for
check.
your health. In other words, something nagging sometimes, but, encouraging the healthy behaviors, discouraging, staying up till 1 and drinking and smoking and all those things.
Right.
So there's a lot of obvious candidates for why relationships would be health protective. But one pathway that no one at the time, and this was about 15 or 16 years ago when I started to do this work, no one was looking at sleep. And sleep was rapidly emerging as we were getting more and more research from large-scale studies showing that sleep was critically important for your heart disease risk, for your longevity, for your mental health, kind of you name it. So we were definitely becoming aware that sleep was this critical health behavior, and it happened to be the one health behavior that couples do together. And so to me, it just seemed like this obvious candidate to link the two and try to understand the role of sleep in actually explaining the health effects of our relationships.
Yeah.
So that's how I got into it.
So, I'm excited to hear your perspective on this. How do you go about researching the impact relationship has on sleep, right? Because traditionally, like when I think of how someone, gets their sleep patterns tested, right? It's like I envision this like white sterilized room hooked up to a bunch of wires. How do you begin to research the impact that sleeping with another partner or another person has on an individual?
Well, you're absolutely right. Most sleep research does involve, bringing individuals into a laboratory under tightly controlled conditions, and again, like the idea is to make them as isolated as possible. And yet that's just simply not what our sleep in the wild looks like. Sleep in the real world, and most of us do sleep with a partner. About 66% of adults report regularly sleeping with a partner. Sleep in the real world is this shared phenomenon. So we're missing a big part of the picture by not looking at the partner. So how do I do it? Well, we use a number of different methods in my research, but mostly I use equipment that can be used in the home.
Oh, okay.
Because I want the naturalistic environment. I don't want those sterile walls. I want the actual sight, sounds, the feel of the bedroom, the couple's bedroom, if that's the context I'm studying. So we can either use actigraphy, which is a wrist-worn device, kind of like a Fitbit or something like that. But we use research-grade actigraphs that measure motion at night, which is a good behavioral indicator of sleep. Because, when you're relatively quiescent, that's an indicator of sleep, along with sleep diaries to indicate that you're actually, that's your sleep window, not just a rest interval. So we use behavioral indicators of sleep, and we have both partners wearing wrist actigraphs. And then I've done a study in military couples where we actually had our laboratory techs attend the home and suit up our participants, one of whom was a service member and their spouse, with polysomnography. So that's like the same technology that we would use in the lab, with electrodes on the brain, on the head, sensors for both muscle activity and eye movement, so we could get the full picture of sleep architecture as well as sleep timing and continuity and all those things. And we do it simultaneously.
Yeah, that's interesting because it's such probably a drastic shift. Although I guess someone who's in the military isn't necessarily going into an environment where they're sleeping alone, nor is it probably as relaxing as it is at home. But
exactly,
I imagine you probably would see some pretty stark differences. Is that correct? Is that in line with what you found?
Differences in terms of what their experience is in sleeping in deployment versus at home?
Yeah, and as well as just like sleeping in their own bed versus sleeping in like a shared bed, right?
Sure. Well, I mean, military sleep is one of the topics that I study, and it's very interesting. And certainly under deployed conditions, the sleep environment is hostile in a number of ways. Actually, even under deployed conditions, sleep tends to be shared because, you're sleeping with fellow service members. But there's also often a very hostile environment in terms of, the threats that are around you. And one of the reasons why, and there's also lots of interference with your sleep, getting called in the middle of the night, or your colleague is being called, or sounds from the environment. There's a lot of interference with sleep in a deployed environment. What really interested me is, what happens when service members come home? And because as human beings, when we're trained to be vigilant, and service members as well as police officers and firefighters and other populations, that's their job, is to be trained to be vigilant day and night. And that was really interesting to me and important to study, because we can't just turn that off. And a variety of ways, we all kind of, at times in our life, might be sort of trained to be vigilant day and night. Like when you're having young children, it's why many women will say that they never sleep as well after they, even once their children start sleeping through the night, they don't sleep well anymore because you've become trained to be vigilant. So in any case, in the service member population, after deployment, one of the things I've been studying is, again, how do service members make that transition back home? And, after being trained to be vigilant day and night and being exposed to a lot of stuff, which can make sleep even harder, well, A, how do they sleep? But also, how does their partner sleep? Because as partners, there's interdependence.
Sure.
And the spouse of a service member also has a lot of transition to make, both when their partner is gone on deployment and when they return. And then how do couples sort of adapt and renegotiate the night? And we found some really amazing and interesting things and amazing stories. I mean, the truth of the matter is spouses of service members also showed a lot of sleep disturbance. And there was also some interesting kind of synchrony between the patterns of service members. Of course, if and his or her partner. So if he's waking up a lot in the night, if he's having nightmares, for instance, her sleep is also affected.
Right.
So again, it's just another example that if we're going to understand these issues around sleep and populations that are at risk for sleep disturbance, sleep does not occur in a vacuum. It happens for many people in the context of a couple. So we have to have both parties involved.
Right. No, that makes sense. So with regards to, thinking about service members, policemen, firefighters, and then, while to a much, much lesser degree, right, those of us who work in the corporate world and tend to be like overly high strung and stressed, have you found through your research any effective means for helping people maybe start to like shut some of that fight or flight off? Yeah.
So in general, kind of how I think about sleep from like a theoretical perspective and what we need to sleep is, first it's important just to step back and realize that sleep from an evolutionary standpoint is an unsafe behavior, right?
Right.
So, you're lying down, eyes closed, semi-conscious. That's like you're really vulnerable to potential threats from the environment.
Saber-toothed tigers.
Right, all these things. And so our brains are hardwired to respond that way. And yet we know that sleep is absolutely critical for our survival. So somehow it has sort of lasted. And so how does our brain learn to feel safe and secure enough to fall into this vulnerable state? And so, so for lots of reasons, that sense of vigilance or anxiety, how do you sort of turn that down so that you can fall into good sleep? There are a number of strategies that we found and that others have found and that I encourage in my clinical practice. Basically, one first step is that the brain needs to feel sort of like predictable environments.
Okay.
Or generally sort of give the brain the cue that safety is here. It's why, if you have young children, we try to follow these very routinized schedule because that helps those little brains sort of know, okay, when you know what's coming next, then you feel safer. You don't have to feel as anxious about it. The same thing applies for adults. We're still creatures of habit. So having some predictable routines in terms of your bedtimes and wake-up times. Also having some sort of ritual or wind-down routine prior to bedtime can start like sort of setting the stage for the brain that, okay, the world is safe and secure. You can enter this potentially vulnerable state.
Right.
You don't have to, stay vigilant and alert. So what can you do? This does not have to be any sort of elaborate process. I think that's, people sort of, when they hear like, oh, you should have a bedtime routine, whether it be for themselves or for their children, they imagine this like extensive, drawn out act. And it really does not, nor should it be that way. Anywhere from, half an hour to an hour is fine, what you can get in so that you're not just racing off to bed.
Okay.
Something, the idea here is really that it's routine and it's relaxing. So you try to do about the same thing every night. So whether that be taking a bath or taking a shower and then reading a book, brushing your teeth and going to bed, or with children, it's sort of like you want it to be a one-way street.
Yes.
So instead of what many parents will do is like they'll do bath and then the child will ask like, oh, can I go have a snack? And so then you'll run back downstairs or whatever it is. Oh, can I, just do a little bit more coloring or playing? And then you'll go there and then it's back to the bedroom and then there's, maybe one more bathroom trip. So it's just like back and forth. Whereas like what you really want is this like very clear step-by-step that's unidirectional, one way to the bed. So it's, brush teeth, bath, to the bedroom where you read a story or two and you have a limit on the number of stories and then it's to bed.
You just described what we've been doing for the last 6 months. And I will say that it's made a huge difference.
Well, bravo.
So like what I was telling you before we started is when we lived in New York, there was no method to the madness. It was just completely sporadic. It depended on what time I got home from work, what we had planned. Because when we had our kids, let me think, I was 27. My wife must have been 24. She's going to kill me for not knowing that off the top of my head. But, in New York terms, like we were actually pretty young.
You're babies.
Right. So like to maintain any sort of social life, like we still had to kind of be out and about. And so that meant that like our daughter came with us, and she slept terribly. Right. Like there was a lot of other things that I'm sure that we were doing wrong, but like what we didn't have was that consistent routine and habit. And moving out here, that's something that we have like now made almost an unwavering priority. You know what I mean? Like we've become those parents that plan their evening around the kids' bedtime. But it's made such a huge difference. Like my son now, he'll sleep through the night and there's no arguing. It's just like he knows once we're in that routine, this is what comes next. And when I set him down, it's, there's still nights where he might like put up a little bit of a fight or get upset, but more often than not, falls right to sleep.
So it's that same idea of safety and security. Children, just like adults, will resist bedtime if there's any cues in the environment of uncertainty or what's coming next. So by having that ritualized sort of routine of it's going to be this and then bed, even if, frankly, many children would prefer to sleep with their parents or would prefer just to stay up with their parents, as long as they know that, that what's coming next is actually safe and it's an okay thing to do. And I've done it before. That creates that feeling of safety, which allows them to sort of downregulate and fall asleep.
Yeah. I read a really interesting book called The Power of Habit. I can't remember who wrote it. Are you familiar with it?
I think I have read that too. Yeah.
Yeah.
I'm forgetting the author.
Yeah, but I know I am too. I'll link to the notes. But it's all about just like the role that cues play and then just like how ingrained that becomes and just like how even in areas where we might not realize it, habit is just so ingrained in the way that we operate day to day. And so when I started thinking about that in the context of like our nighttime routine, that's what in part drove a lot of the change around the way we dealt with our kids. And I don't know if I necessarily thought that should apply to myself as an adult as well. So it's really interesting to hear that, almost from like a biological evolutionary standpoint, there's a literal need to be able to kind of like understand that you're in a safe environment. Just because we're not always, well protected in suburban homes. Right. So that's really interesting. So, how do you like measure what would be a good night of sleep? Or I guess, either qualitatively or quantitatively, how do you quantify like what a good night of sleep looks like for someone?
So it really depends on the context in which I'm asking it.
Okay.
If I'm doing it in a research study, I might have many different metrics, including objective measures, whether it be sort of a behavioral assessment using, actor graphs to see how continuous or discontinuous the sleep was. Maybe I'll be measuring something like sleep duration, also very important.
Right.
But, I might do something even more in depth, like, measuring brain activity during sleep, which could tell me something about the depth of sleep.
Yeah.
But what's also critically important is simply asking people, how well did you sleep last night?
Yeah.
Do you feel refreshed in the morning? How would you rate your sleep quality?
Yeah.
And so both in my research life as well as in my clinical world, clinically, that's where the action lies, because I mostly treat people with insomnia. And the truth of the matter is that insomnia is a disorder characterized by the perception that may or may not be mirrored in objective measures of poor quality, non-refreshing sleep. So there's frankly no objective measure that's more important to me than their report that I sleep miserably. I worry about my sleep. I don't wake up feeling refreshed. So that's what I need clinically, mostly to go on, is to try to improve that experience of sleep and how you're feeling during your day.
Yeah, that makes sense. And so something that I've always thought was interesting too is, say someone has always slept poorly. Like let's say someone has sleep apnea, right? And weren't necessarily aware that they had it. That's just what sleep had always been to them. Do you find that there's often a difference between what someone perceived as the quality of their sleep versus what you're kind of like objectively measuring?
Absolutely. And I see it in both directions. So sometimes people, for instance, with apnea, which is a disorder where you with or without your knowledge, you're actually waking up many times during the night because you're not breathing well.
Yeah. Slight problem.
Yeah. So that sends a strong signal to the brain. It's time to wake up. But it's due to the collapsing of the upper airway during sleep. So they may not actually experience that. I mean, that their sleep is poor, but they probably are feeling a lot of sleepiness during the day.
Right.
But they may not know why. Some people with apnea actually end up thinking that they're depressed or get diagnosed with depression because they just feel sleepy and lethargic, but don't really tie it to their sleep in any way.
Yeah.
And yet then we measure their sleep and we see that, in fact, they're not breathing throughout the night and they have all these awakenings that they might not even be aware of, which is causing this really fragmented sleep. But also we see the flip side sometimes with people with insomnia that, if you ask them, about their sleep, they'll tell you that they, either have great difficulty falling asleep and great difficulty staying asleep, or just the quality of their sleep is really poor.
Yeah.
And they might say, I probably don't, get more than 4 hours of sleep per night. If you measure them in the laboratory, kind of with our current sleep assessments, it has been found often that they don't show the same level of objective sleep disturbance that they describe.
Oh, okay.
And yet, and so that kind of sometimes suggests, oh, well, these people are just complainers, which is absolutely not the truth.
It's not the case.
No, it's just that our objective measures measure something different from our subjective experience of sleep. And we actually may not be tuned in quite enough yet to effectively measure what's going wrong with sleep. Because, for instance, what my patients will tell me often is, I might have been asleep, I might not. It's kind of like that experience of a light that's like at half mast, sort of flickering. And that's often the experience of insomnia where, I could be asleep or I might not be asleep, but I know that at any moment during the night, anything could wake me up.
Right.
And so it's that very shallow, easily disrupted sleep that is not at all restorative, and that is so debilitating for people with insomnia. So it might just be that we're not measuring it objectively well enough yet.
Okay.
And it's also true that in many cases, how we feel about a certain experience doesn't necessarily map on to our objective measures.
Yeah. I've noticed, so like we were talking about before, I for me to get to my desk, it takes 2 hours in the morning, right? Okay. So on those days, I'm up at 5, maybe 5:30 if I'm going to catch a later train so that I can, get up, I can work out, and I can, kind of get myself on my way. I find that like emotionally, the emotion that comes with like the stress of like knowing that I have to be up at 5, that alone will like wake me up in the middle of the night. Or if I wake up at say like 2 and I glance at the clock, I'm like, oh no. Like I only have 3 more hours left. And then like that kind of like surge of, I don't know what maybe it is
adrenaline,
fear.
cortisol.
Yeah. Adrenaline. Yeah. It's like, and then that's what causes me not to be able to go back to sleep. Yeah. And there's a lot of folks in my area who make that brutal, terrible commute and we all kind of like commiserate about that. Right. So.
Well, it's like anybody, when you have an early morning flight and you have to be up at 4 a.m., and you set your alarm for that, but you're actually up at 2 a.m.
Yes.
So,
right.
it's that anticipatory, anxiety.
Yeah, it's anxiety.
And that's often, again, that is very much what I see in my insomnia patients is that sort of the inability to actually shut the brain down, that you're so predicting what's coming next.
Because you're already probably so frustrated that you felt like you haven't been sleeping that it's like,
Yeah.
I
So
totally
and now
get
the
that.
pressure's on, and if you have to wake up at 5 a.m. to get out the door, you want to, you're already calculating the hours of sleep that you possibly can get. And if you wake up in the middle of the night and you see it's 2 o'clock, you're starting to do that mental math of how much do I have left? How quickly can I fall back to sleep? And again, if you go back to that safety and security perspective that I'm talking about earlier, all of that stress, that worry, that mental calculation, that's all a fear response. From a physiological perspective, it sends,
it's sending all the same
hormones.
signals. Yeah.
So that's not telling the brain that the world is safe and secure. So it's making it actually more difficult for you to sleep.
Do you have any suggestions as to, now this is me just selfishly asking, this is no longer concerned about the people listening along.
Okay.
So let's say, like on those days, and I have a little bit of a wonky schedule because like maybe 3 days a week I'll go into New York. The other 2 I work from home. Right. Okay. So I try to keep to a pretty, a regular schedule as to like when I wake up and when I go to bed, so that like I can kind of like get myself in a pattern to where on those mornings where I do have to wake up early, there's not as much anxiety.
Sure.
But in all actuality, that still ends up often coming around just the same. Like, do you have any recommendations to people that face that kind of anxiety? Because what I find when I talk to folks is that's actually pretty common.
The anxiety about like,
I got to be up at 5 and
Yeah.
I just woke up, it's 1. And then that ends up causing you to be up for the next 2 to 3 hours. And then,
Sure.
you just feel like you're caught in this like terrible cycle of poor sleep after poor sleep.
Sure. So, I mean, there's a couple strategies if you're waking up in the middle of the night and also if you're starting to feel anxiety around sleep.
Yeah.
I mean, the first thing is, again, like with children, trying to keep your bedtimes and wake up times, even if you have sort of the luxury of a somewhat flexible schedule wherein, some days that you have to go in even earlier.
Right.
I mean, to be honest with you, it'd probably be better for your system to try to have a more consistent schedule throughout the week and keep your bedtimes probably earlier than you want them to be to allow for those earliest morning wake ups so that you have more consistency.
Yeah.
The second thing is if you wake up in the middle of the night, the first thing that everybody wants to do is look at the clock. And that's like the death knell. Just do not look at the clock. There's nothing that it's going to tell you in the middle of the night that is going to make you happy or peaceful or more likely to fall back to sleep.
Yeah, exactly. There's no good information coming your way.
No, just, it's the middle of the night. That's all you need to know. Leave it there.
Yep.
And if you actually have, an actual clock in the room, which, unfortunately few people do anymore, and instead they just have their phones, which I would say bring back the, alarm clocks because that's their only function and they need a job and they're good at it.
Yeah.
But have an alarm clock in the room in case you need an alarm for the morning, but turn it around so you don't have to see the numbers on the screen. And certainly don't look at your phone in the middle of the night. And instead, if you wake up in the middle of the night, which by the way is perfectly normal. So sleep is not a coma.
Right.
I think we also have this unrealistic idea that like when we fall asleep, we need to be like, knocked out.
Yeah. And I wanted to ask you about that. So I'm interested in this.
Sleep is a dynamic state where, we go through about, 5 cycles throughout the night, about 90-minute cycles where we're transitioning through different stages of sleep.
Yep.
And through those transitions, it's also very normal to have awakenings, which can be brief. They can even be outside of your awareness.
Okay.
That's what mostly happens. And that's a totally healthy thing. There's nothing wrong with that.
Right.
As long as it's not happening, very frequently and or if the awakenings are extended.
Yeah.
So the problem is if you wake up in the middle of the night for whatever reason, and then you can't fall back to sleep. So then what do you do to avoid that anxiety that creeps in?
Sure.
So the first thing is don't look at the clock to find out, that you're screwed or that you're going to be more upset by it.
Yep.
If you find that you wake up and you kind of roll over once, you roll over twice, you're sort of lying there and you feel that like sleep isn't coming, if you think about a half an hour has passed and that's your internal judgment, that's not looking at the clock.
More subjective than...
Totally subjective.
Yeah.
You do not need...
We all kind of know that feeling of like...
when your brain is like, oh, I'm awake.
Yep.
If you're awake, get out of bed.
Okay.
Go get out of bed. Do something relaxing in low light conditions like reading a book or, listening to a podcast.
There
perhaps.
we go. Turn on the Professional Athlete podcast if you can't sleep.
Yeah, a really boring one.
Yeah. We'll put you right back to sleep.
And until you get sleepy. But, and sometimes, there might be some nights that you're just like really keyed up and you might have a, really big thing to do at work the next day. Or if you're an athlete, you might have some, major event happening the next day.
Yep.
You know what? The most important thing is to distract your mind at that point from the fact that you're not sleeping.
Okay.
Because that focus on I'm not sleeping is so stress producing and anxiety provoking that it's, flooding your body with stress hormones, which is not going to facilitate sleep.
Right.
So the thing to
just
do...
going to exacerbate the problem.
It's just going to exacerbate the problem. So if you could distract yourself, you might actually find that you get sleepy again, at which point then without sort of effortfully trying to sleep, you'll fall back to sleep.
Yeah.
And you'll also just reduce that likelihood of a habit forming of being anxious and awake in bed, which is what so many people do.
Yeah, and I think that's the most frustrating thing is that feeling of like trying to sleep.
Yeah.
like trying to force yourself to relax, it's almost an impossible task.
It is an impossible task because, again, your brain is going to fight against that. If your brain thinks like you're effortfully striving for something that could be unsafe, like it's going to like put all the stops in. And that's why actually in insomnia treatment, you know, it's really about sort of turning the problem on its head. People who have insomnia are effortfully trying to sleep. And actually what the most, you know, the strongest treatment, which is behavioral treatment for insomnia, actually stronger than any pill, actually sort of flips that idea on its head. And instead of, you know, effortfully trying to sleep, you know, I as a therapist, you know, effortfully make you stay awake for longer periods of time. And by doing that it paradoxically kind of flips the cycle and allows you to fall asleep, because sleep is an involuntary process. You cannot force yourself to do it. And the more you chase it, the more it's going to elude you. So we actually work with extending wakefulness, and therefore you're able to sleep.
So, and I think this could be because it's been such a point of interest for me in the last few years, but I feel like I'm having more and more conversations with people, clients, people who are like acquaintances as opposed to friends, where like sleep just ends up coming up. And I talk to so many folks who just, really struggle with it. And I know, you know, we're a culture where it's like everyone, and I don't think, you know, for nefarious purposes, no one's looking for the quick fix. That they literally just want to be able to sleep. So they turn to, you know, pills, different forms of medication. I know some people, you know, resort to just Benadryl, just anything to try and make them drowsy. Sure. But it sounds like from your perspective, an approach might be, and I imagine under the supervision of a clinician would be like the recommended approach. But not trying to fall asleep, perhaps maybe even trying to sounds like stay awake until you naturally are forced to fall asleep is a better approach.
Absolutely. And again, you know, when it comes to the clinical disorder of insomnia, the recommended treatment is a behavioral one, not a pill form, not any sort of pharmacologic medication. And again, I agree, it's not necessarily nefarious, but it is part of our culture that there's a pill for everything. And it's also the
not
case...
nefarious on the person who just wants to sleep.
Who wants to sleep because it's, you know, you feel desperate and it's and you need your sleep. So it's an understandable thing to want treatment for it. Right. Unfortunately, you know, many providers aren't even aware of the behavioral treatments that are supposed to be the front line. And, you know, in some areas, there's not access to a therapist. So there are some strategies that people can follow. Certainly if you have, you know, a really significant sleep problem, you really should find a provider to help you deal with the problem. But there are some strategies that are sort of based on the most evidence-based treatment, which is cognitive behavioral therapy for insomnia, which people can apply. And like you said, you know, one thing is to wait for your body to be physiologically sleepy. So one of the things that some people who are struggling with sleep will start going to bed sort of excessively early. Right. Because they're already calculating, well, if it's going to take me 2 hours to fall asleep, I better go to be in bed at 10 p.m. because I'm not going to fall asleep till midnight. And then when I ask them, you know, so when what says it's bedtime at 10 p.m.? Are you sleepy? No, it's just 10 p.m. You know, and I said, well, you know, but you're not going to fall asleep for 2 hours. Well, no, but if I didn't, then, you know, there's the concern that but I'll be up 2 hours later. But, you know, the point is you can't rush, you know, a physiological act. Again, it would be sort of like, you know, if you sat down to the table and waited to get hungry, you would never do that. Right. So you do have to wait to be physiologically sleepy. And if you're not sleeping, you shouldn't be in bed. Yeah.
And I feel like that too. And you can tell me if I'm correct in thinking this, but that probably just only like reinforces that like kind of anxious relationship with sleep.
Yes. So
you're putting yourself in a no-win situation by forcing yourself to try and sleep when your body's not ready.
You're forcing yourself to, exactly. You're putting yourself in a no-win situation and one of frustration. Right. And then the bed starts to be equated with frustration and anxiety and stress instead of, you know, a pleasant experience of relaxation, restfulness, and sleep. Yeah. So it really sends the brain the wrong signal that, you know, that the bedroom is this place of like effortfully striving instead of falling into this, you know, deep natural sleep.
Yeah. So something that you mentioned that I've personally, my wife and I both actually have started to pay more attention to is I used to be more concerned with, I need 8 hours a night, or I need 7 hours, or, you know, whatever that amount of time frame was that I felt was like the appropriate
Magic
recommendation
number.
of the day. Yeah. And I've started to think more in terms of cycles. So let me start by saying I only have a very high level understanding of what a sleep cycle entails, but in thinking of everything in kind of like 90-minute increments, I've been trying to at least allow myself a window of time that, theoretically is going to let me get through a full cycle. Based on your research and, your kind of expertise, like, is that a good approach? Should people be thinking about, get X amount of hours, or should people start more closely tracking like sleep cycles?
Well, I mean, I think that the technology for, commercial use and in-home use of measuring our sleep cycles is, not perfect by any means. So I wouldn't rest too heavily on that.
Yeah.
I think it's not bad to be sort of aware that the body sort of naturally, ideally goes through about 4 to 5 cycles per night, each 90 minutes.
And would you say 4 to 5, when we start talking about like, recommendations, that's like kind of that, what is that? 7.5 hours?
Yeah.
That's kind of what people should be striving for?
Ideally.
Okay.
That said, there is no magic number. Whether you look at sort of cycles, and I mean, again, this is I think, an imperfect science at home.
Yeah.
So I don't think it's worth hanging too much of your sort of emphasis on that. Although, if it ends up getting you around 7 to 8 hours, well, interestingly enough, that sort of then also is in parallel with the general recommendation, though it's not true for everyone.
Right.
Again, it's not a magic number, but most people do function best, somewhere in the, 7 to 9 hour range.
Okay.
There's absolutely going to be individual differences. And again, whether you think about that from a cycle perspective or from a total sleep duration. Mm-hmm. But what I really don't want people to get so hung up on is this like pursuit of the magic number.
Yeah.
Because we also want to be paying attention to the quality of your sleep.
Right. I'm glad you brought that up.
I can get you, 8 hours of sleep by just putting you in bed for 12 hours a day. Mm-hmm. And that will not feel like good quality sleep because you'll be in and out of it. You're not going to sleep for 12 hours. But, given, a longer enough period of time, you could kind of go in and out of sleep and we could add it up to be 8 hours. That's not how we experience good quality sleep. It's also not how we experience the benefits of sleep in terms of our, vitality during the day, our productivity, and our mood.
Right.
What we experience as good quality sleep is generally deep sleep that is also consolidated, not broken up in chunks throughout the night. So sort of being mindful of how do you feel when you wake up?
Yeah.
Do you feel, and not in the first 15 minutes, everybody feels pretty crummy, except the extreme morning people.
Right.
After you kind of shake the cobwebs off.
Damn them.
Yeah, exactly. But once you've shaken the cobwebs off, once you start your day, do you feel refreshed? Do you feel like you had enough sleep? Are you, needing to have, 3 or more cups of coffee per day?
Yeah.
Are you thinking that you need a nap? Are you not able to get through the things that, you want to do, you need to do during the day? Those are indicators potentially that you're not getting enough sleep.
Okay.
If you're able to function at a high level and you're getting, again, at least I think for most people, a minimum of 6 hours. I mean, there's a lot of people out there that claim that they're definitely the exception. And I think I've met
4 hours a night.
Oh yeah. And I've met every one of them. So, and it's only 2% of the population that is a natural short sleeper. So, nobody else is invited because I've already met all of them, I'm sure. They all tell me, but I'm the exception. So, it's a small crowd that is in that 2%. So most of us do need more sleep than we're allowing. But I think checking into multiple metrics and, it's not just the duration, it's not just the number of cycles, it is how you experience your sleep and are you consistently achieving that? Because it's not good enough to get, one good night of sleep followed by 5 bad ones.
Yep.
It's not a bank account where you can sort of like get one good night and like disperse it throughout the week.
Yeah, no big deposit that you can then kind of like pull from. It's about consistency.
It's about consistency.
Yeah. So it's funny you say that because I just had a really good conversation with my buddy Noah, who's a broadcaster, and we were talking about working out more broadly. And I was like, look, there's a lot of different workout plans. There's a lot of different ways to skin the cat. Like depending on what your goal is, there's probably multiple ways to get there. What's probably going to be more important is like, are you consistently doing those things over time versus like some silver bullet? So it's, just kind of the parallels across different disciplines, right? I think are pretty interesting. With regards to quality of sleep, this is something I've also been trying to think more about. What do you define as quality of sleep? Is it, as you were saying, more like subjective? Like, do you feel well rested and able to operate at a high level? And I guess is that I guess you've already answered that then.
Yeah.
What are some of the things that you see people often doing that are preventing getting a quality sleep?
Sure. So a number of things, and sometimes we're not aware of some of the things that we may be doing that are interfering with the quality of sleep. So I think it's a good question. So things like, caffeine or excessive alcohol.
As I look at my giant mug of coffee.
Yeah. So even if, some people say, I'm not at all affected by caffeine or I'm not at all affected by alcohol. And excessive amounts, and particularly later in the day of either, can actually definitely interfere with the quality of your sleep, even if you're not necessarily aware of it, but can actually lead to more awakenings. It can change the depth of sleep.
I've heard with caffeine, there's like a half-life that occurs where it's like somewhere around like 6 hours, like try and not have caffeine within 6 hours of when you're probably going to try to go to bed.
That sounds about right. I mean, my general rule of thumb is actually usually to try to cut things off at about 2 p.m. So that would be sort of we're a little beyond that.
I'm butting up against
that would be around the 8 hour for most adults. If bedtime is closer to 10 p.m. But and again with this, you can't be so rigid about times because everybody has individual differences. Yep. And so again, if you're having any problem sleeping or if you're having problems with daytime fatigue or something like that, then you want to kind of really clean up these acts and why do things that are going to potentially mess with the quality of your sleep. So caffeine earlier in the day is better. Okay. Other things that can disrupt your sleep quality are things like pain. So if you, are having any sort of injury or pain, that absolutely will disrupt the quality of your sleep. Frankly, any other, medical conditions can, or other sleep disorders. So sleep apnea being one that really can disrupt the quality of your sleep, but you may not be aware sort of what the cause of it is. Right. Other people that we share beds with can also disrupt the quality of your sleep, as you know.
And I wanted to ask you about that. Yeah, because I know that, in addition to, I suppose, sleep more broadly and your work with insomnia, right, your work on couples, I think is super interesting.
Thank you.
So I would love to hear a little bit, and I would actually open it up to you because I'm so like ignorant in this category, despite the fact I sleep next to my wife every night. How is sleep affected by our partners?
Sure. Well, I mean, what the studies have actually looked at like couples sleeping together, and they're actually fairly few because, as I said earlier, most studies look at sleep as an individual behavior, despite the fact that most adults sleep together. Yeah. What they show is that sleep, among, bed sharing partners is highly interdependent. And something like, particularly if you sleep with a snorer, you can sort of blame your partner for up to, 50% of your sleep disruptions caused by the other person. Yeah. So there's, definitely in some cases, there might be a reason that your partner is having a big impact on your sleep. But there's a lot to be said of what we get out of sleeping together. And a lot of my work is simply about trying to explore this topic in a really sort of open and objective way. Okay. Yeah, without
not bringing
judgment.
In the bias of
that there's one, that there's one way we should or shouldn't be doing, because we frankly don't know. And what we do know is that sleep is one of the most intimate behaviors that people can engage in together. It's also critically important. Sleep is for every aspect of our functioning, including our relationship functioning. Yeah. So rather than focusing on some predetermined idea of what couples should or shouldn't do, what we really need to know is kind of what are the potential impacts of bed sharing, and what are the possible things that could interfere with couples sleeping well together. And, if either partner isn't sleeping well together, then why is that? And what are some strategies to overcome that, including having conversations about sleeping apart, if that works for a given couple.
Yeah.
But kind of removing the judgment around, this is what my parents did, or this is what my friends are doing, this is what my neighbors are doing, and that's therefore what we should be doing. I mean, sleep is, occupies a major part of our coupled existence, about 1/3 of our time together as a couple.
It's incredible when you think about it in those terms.
Right, like
just the sheer amount of your life that you spend in bed.
Right. With your partner.
And to your point, right, the sheer the amount of time within your own relationship that is spent with your partner is in bed.
Yeah, it's like the largest concentrated period of time that you potentially spend with your partner.
Yeah.
So we have to be more mindful about it and have a conversation about, what's working, what's not working, in the context of our own couple, not what, the people down the street are doing, or what, you hear
not
about
what
people
the
doing.
Van Dykes are doing down the street with their separate beds.
Right, exactly. It really, that's their choice. This has got to be your choice. But with the idea that sleep matters so much for the quality of your relationship, because when you're not sleeping well, you're not as good a communicator. You have a hard time empathizing with your partner.
Yeah.
You lose your sense of humor. Like all these things that are really important for being a good partner go out the window when you're not well slept. So we've got to, why isn't it that we have, talk about like our sleeping habits in the context of, premarital therapy? We would never do this, but like we really should. It's 1/3 of our coupled existence.
It's so funny. And we were catching up a little bit before we started recording. That was kind of one of the driving factors behind me getting interested in doing this podcast, right? So, now I have 3 kids, but when I operated by myself as a bachelor, or even when, my wife and I were just dating, I could stay out all night drinking and I would have enough energy left to get through work and be productive enough that I kept my job and you know what I mean? And then maintain my relationship with her. But as all these responsibilities kind of started to get piled on, and they're totally amazing, but I'd be lying if I said they didn't add stress and worry and, responsibility. I started to realize that there no longer was enough energy to get me through the entire day. And where I started to fall short was in the areas when I took a step back, really mattered to me. Yeah. If I had a poor night's sleep, I still might go to the gym and I would check that box. And then I would get through work and I would have enough and I would, pumped up on caffeine. I'd be able to get all my stuff done and still do really well there in that arena. But by the time I get home, I was spent.
Yeah.
And with 2 kids, right?
Yeah.
That's round 2. They're Dad's home,
exactly.
Mom's home, that's what they've been waiting for all day. And they need your energy because they want to spend time with you. And so I became really frustrated with myself in that I didn't feel like I had the energy left to kind of put my best foot forward there.
Yeah.
And then on top of that, right, this whole idea of maintaining a relationship, forget just having enough energy and still being funny and empathetic, just even the energy to stay awake to have a conversation. Right. And I was oh man, something is completely out of balance here. I really need to start paying attention to what I'm doing and I'm always thinking about it in terms, I keep calling it my energy, but not in this sort of woo woo foo foo way,
but literally,
literally how I'm feeling, do I have enough energy to get through the day?
Well, I know it's true. I mean, sometimes, when we're sleep deprived, we can push through you're unlikely to, take out your irritable, grumpy ass, sleep deprived mood on your boss.
Yeah, exactly.
But, unfortunately, it's our families that bear the brunt of the consequences of sleep loss. And, and by the time we get home, we sort of push through.
Yep.
You might be able to maintain that, in your sort of external, outward-facing face.
Right.
But then you get home, the people who love you the most, the ones that you count on and that they count on you, that's when, again, you're spent. And so that's where the sacrifice, really starts to literally hit home. And I hear this, often that it's when, the sacrificing sleep really, people are able to, push through in productive lives, but what's taken the hit is their family lives.
Right. Well, and so I can't remember if you even said it today or in one of your TED Talks that I was just watching, but you said something to the effect of sleep should kind of be the first means of, therapy. Right? Basically, like if there's problems at home or if there's problems at work or problems at school, like sleep might be the best place to start. And, the way that I found out about you was you're coming into our school district, and I think they're trying to do some progressive things with sleep in terms of, and I'll let you speak to it because I'm just going to stumble through it. But as I understand it, right, recognizing that, physiologically at different points in an individual's life, they have different sleep needs. And traditionally, we haven't done a good job of catering to that. And so with that, I know you're doing a lot of work around like high schoolers.
Yes.
Would you talk a little bit about, what you're trying to encourage in the educational arena in terms of better understanding the sleep needs of a high schooler and kind of what is taking place that it's such a grave concern that like we need to start taking action?
Sure. Yeah. So I'm here speaking to the local high schools about healthy school start times.
Yeah.
And I do so around the country, and I have a TED Talk on the topic. We know that adolescents are a very high risk population for being sleep deprived.
Yeah.
In fact, only about 1 out of 10 adolescents regularly gets the roughly 9 hours of sleep that their developing brains and bodies need to function optimally. So, across the lifespan, our specific sleep duration needs do change.
Yeah.
Sort of in our younger years, our children and infants need even more sleep. Mm-hmm. Adolescents are not just little adults; they still have rapidly developing brains, so they need more sleep than adults. Again,
and I feel like we forget that.
We forget that. We treat them as little adults, and we then blame them for their bad behaviors that it's irritability, grumpiness, poor judgment, all of which actually could be related to sleep deprivation.
Yeah.
So this is a chronically sleep deprived society, and there are certainly lots of reasons why they're sleep deprived. I ascribe to the idea that there's a single magic bullet that's like the causal factor.
Yeah.
But we do know that during adolescence or during the transition, when adolescents reach puberty, there is a unique change in their sleep-wake cycles such that they're shifted about 2 hours later than what we see in adults or younger children.
Yeah.
And this is driven primarily by a delay in the release of the hormone melatonin, which is the hormone of darkness. That signals to the brain that it's time for sleep or that you should get sleepy.
Yeah.
Teenagers' bodies wait to start pumping out melatonin until about 2 hours later than adults or younger children. So biologically, they are programmed to stay awake later and sleep in later. But unfortunately, right at the time that their bodies are showing this biological shift, something which is not at all under their control, we have school start times starting earlier and earlier. The average school start time in the U.S. is about 8:03 a.m. Here in this district, it's, I think, 7:30 or 7:33 a.m.
So I remember it might have changed my junior and senior year, but we were at a high school, a big public high school, north of Seattle, Arlington, Washington, and it was overcrowded. So we went on this kind of crazy like block schedule.
Okay.
And I remember as a freshman and sophomore, I think I had to show up at 7 a.m.
Oh my gosh.
Because we had to get a whole period in before like the next set of students came in because we had to but I just remember I must have been getting up at before 6 easily to be able to get to school, and then going to football practice, basketball, and then on top of like trying to stay awake.
Yes.
In like 7th grade whatever that was, algebra, like it was brutal.
And so there's this direct conflict between the policy, which is in this case, this time school starts, and adolescents' biology. They're in direct conflict. Waking a teenager up at 6 a.m. is the biological equivalent of waking an adult up at 4 a.m.
Yeah.
It's like we're literally turning our teenagers into shift workers.
Right.
And we know there are consequences to that. So I'm speaking about the importance of shifting school start times to a healthy time. The American Academy of Pediatrics, the American Medical Association, and virtually every other medical organization that has commented on this all recommend that middle and high school should start no earlier than 8:30 a.m. And I actually just participated as an advisory board member on the Pennsylvania Joint State Government Commission, which studied school start times.
Great.
And they too came to the conclusion that schools across the state of Pennsylvania should at least consider the science and consider moving start times to a more healthy option to accommodate the needs of adolescents.
Yeah. Are you finding that these school districts are receptive?
Yes, generally. I think that
I feel like anyone who has kids is probably maybe a little more likely to empathize.
you would think. I mean, but still, there's definitely, kind of my job is to sort of educate the community on the science behind it. Because there's still, sort of like we were talking before, there's still this
Right.
cultural attitude of like, well, let's toughen them up.
Yeah.
I,
That's a good
had
point.
to, walk through the snow for miles and started the day at 7 a.m. and blah, blah, blah. To which I always say, like, I used to also ride in like a milk crate in my parents' car.
Right, exactly.
Before there were seatbelts. And by the way, we wouldn't suggest that, now that there's actually science to show that seatbelts save lives, we wouldn't say that's a good idea just
Right.
because we survived. Similarly, even if we survived with early start times, many of us did not because actually start times have actually gotten earlier and earlier.
Oh, okay.
But so we actually still have this idea that, by supporting the sleep needs of our teenagers,
Yeah.
when their brains are rapidly developing, that somehow we're coddling them.
Yeah.
And again, I think this is still part of the societal idea that, sleep is for the weak. And so you toughen people up.
I think
by
that's
sleep
what, I think you just summed
depriving
it up. It's this idea that sleep is for the weak.
Yeah, so we really need to so there is definitely, an opportunity to sort of educate communities. That's what I do, and that's why I'm speaking broadly about this, because I think, changing start times is not an easy thing. School start times do really set the rhythm of entire communities. So there is a ripple down effect.
For sure, right.
So there are logistics, absolutely, that have to be handled. And it's
Yeah.
not easy, but you first have to understand why we're undertaking this,
Right.
why it's when the stakes are this high, that truly the health, the well-being, the academic performance, the future productivity, and indeed our economy
Yeah.
is dependent on supporting the developing brains and bodies and minds of our teenagers.
Right.
And it's a very vulnerable period. A lot
Yeah.
can go wrong during the teenage years. So, rather than coddling them, we are really supporting their healthy development. So that's really what I'm here to do, is to really educate on the science of why adolescents struggle so much to get enough sleep, the problem with early school start times, that it's not merely a matter of parenting
Yeah.
or a matter of, teenagers just being lazy,
Yeah.
and that there's something that we can do about it.
Yeah, I love that approach, and it's it's easy to forget that their brains are developing, and it's. I think about this for a lot of different reasons. Like I played football through college, and there's all sorts of research about CTE, which is fantastic that research is coming out and thinking about like, well, what is the damage you're inflicting while your brains are still developing? Making that leap to like, well, let's just think about like how disruptive it is to pull a kid out of the necessary sleep to like continue, like for that brain development to flourish.
Yeah.
So I'm really glad to hear that folks like yourself are, increasing awareness, and hopefully our school district's receptive.
Well, they've been great so far,
Awesome.
and it's great that they're just even having this dialogue. And I
Yeah.
hope the community will, be able to, come out and express concerns, because it's one thing to express concerns, but
Yeah.
then allow the opportunity to be a part of the problem-solving process. It's, it may not be the, convenient for
Sure.
everyone. You might like your schedule currently.
Right.
And yet what
parents got to get to work. They
Yep.
might be in a routine
Yep.
in which they get their kids out the door at a certain time
Yep.
and it works for them.
So
Totally get it.
change is hard. I get that.
Yeah.
But don't take this lightly. We're not taking this lightly. The reason schools would ever consider this is because the stakes are so high.
Yeah.
To do nothing is to do harm.
Yeah.
And that is what's currently happening when teenagers are deprived of the sleep they need.
Okay. So for you, because I know we need to wrap this up, you have a busy day ahead of you still. So thank you for joining. I really appreciate it. Let me just ask you, it's completely open-ended, like what are you kind of interested in right now with regards to sleep? Like, is there any new frontier out there that you're excited to begin researching?
I'm excited about a number of things. I'm doing a number of things, both in looking at some of the broader health consequences of sleep loss. I'm now studying how sleep loss contributes to cognitive aging and dementia risk.
Oh yeah, I wanted to ask you about that.
Yeah. So sleep
I
is...
feel like we could probably, I'm sure we could have a whole nother conversation, but okay.
I'll just say it's really important.
Yeah, okay. Bullet points. Take note.
And I'm interested, so we're pursuing some research in that area to understand how sleep contributes to healthy or unhealthy cognitive aging and risk for dementia. I'm also really interested in looking at caregivers and partners of people who have either dementia or mild cognitive impairment, and the impact on their sleep and their health risk. And then also sort of in the couples angle, I'm also now interested in sort of bridging my research to look at kind of, now that we know that sleep and relationship quality are so interconnected and the sleep of partners is so interdependent, well, how can we use that knowledge to actually develop new and innovative treatments for couples to help each other sleep better and actually engage the partner, either both in the treatment of sleep disorders, as well as sort of more on the continuum of sleep health. How can we even use technology among partners to help partners become better supporters of positive sleep kind of in the couple dyad?
Yeah. Oh man, that sounds awesome. Well, we'll have to have you back at some point. I would love to hear about both of those. My grandmother, who passed away a few years ago now, I don't know if she was specifically diagnosed with Alzheimer's, but I remember it was some form of dementia. And it's hard, right? That's really hard to see, and especially a loved one. You don't want to see someone go through that. It's hard for everyone involved. And so, I've seen some of this kind of preliminary research come out that indicates that it could be really closely correlated to lack of sleep and like the inability for the brain to, kind of like do all its processing and flushing out the brain. And so, it kind of makes me think like, gosh, like had we just known more, could it have been something that had been prevented? So I'm very interested and glad to hear there's people like you working on that. So for people who would either, like to learn more about you or get in touch with you or hear what you're working on, like where's the best place for people to find you?
Probably best place to find me is through the RAND Corporation, the RAND website. You can just Google my name, Wendy Troxel.
Perfect.
Also, at Wendy Troxel is my Twitter handle. And
awesome. Well, great. Awesome. Well, thank you so much.
Thank you.
All right.
Mommy, you better go ask Mommy, Daddy.
All righty. And it is now that time where we run it by Minovia. Good evening, Sonia.
Good evening, Novio.
Oh, boy. Lots of Spanish. Bilingual podcast. So I thought this podcast was awesome.
Yeah, I think this one was my favorite so far.
Yeah. I was so fired up about it for so many reasons. One, we got to actually do it in person.
Yeah, that was cool.
Which was great. It just, it's always so much more enjoyable, like when you can actually be in the room with the person talking.
No video though.
No video.
You kind of creeped her out.
Yeah. We're going to have to work on the approach there. We need like some sort of production buffer.
Kenny was like, "Do you mind if I tape you?"
Yeah, I know. Well, that would throw that would throw the best of people off. But we did get awesome audio. She was great.
Yeah.
And I felt like there's a lot of stuff in there that was really interesting, but there was also a lot of like things that are hopefully really easy to implement. You know what I mean?
I thought so too.
So, well, actually, I'll ask you. What did you think of the podcast?
I loved her. I thought that she had some really easy things that she said that we could easily do.
Yeah. Well, why don't we dive right into it? So, fun fact, 1/3 of our lives is spent in bed. That's not new to people. However, should you and I be married for 75 years, that means that we will have spent 25 of those years sleeping. Wrap your mind around that.
Wow, that's weird.
Yeah. So one of the first things she said that I thought was really important is you need to build a relaxing routine before bed, right? Like we're creatures of habit. And I thought that her take that from a like evolutionary standpoint, right? We've kind of like evolved to always be on high alert, especially when sleeping, because like that is when we're most susceptible, quite frankly, to being eaten.
Yeah.
So it's like we need to put ourselves in this routine to kind of calm ourselves down and like let our brain and body know like, hey, we're safe, we're secure, it's okay to doze off. Mm-hmm. I feel like we've gotten better at doing a routine.
We were good at it before our newest baby, whose name shall not be said, was born.
Wow, slip up.
You had a face routine, our mouth routine. You even got a nice gusha massage every night.
I'm going to pull
some
you from the
CBD oil.
podcast if you start. Like, people are going to be like, well, what?
Kenny made me massage his face when I was 9 months pregnant.
That's not exactly.
Every night.
That's not entirely how it worked. But yes, we did have a nice routine. My guilty pleasure, though, is capping it off with The Office.
Yeah.
Which is a TV in the room, which is one of her do nots.
Which I never liked before we started dating. I never had the TV on before, but I never had a TV in my room. I never wanted one.
Oh.
You know that.
So this whole time, I've just been holding you hostage watching The Office against your will before bed. You seem to enjoy it, though.
I do.
For someone who doesn't want it there. But no, we can cut it out. To be fair, I have been reading books before bed.
And I'm watching The Office.
And you're watching The Office, yes. And I'm reading the riveting tale of Ulysses S. Grant.
Yep. That's what you're doing.
It's a very big and impressive book.
It is.
So that's an easy one. Get rid of the phones. She recommends an hour before. I do a pretty good job of that, I would say. Mm-hmm. Others on this podcast.
I don't do that.
Not so much. So
my nighttime routine is much different than yours, though. My night is much different than yours because I'm waking up with the baby.
With the baby.
And being on the phone while I'm feeding the baby helps me stay awake.
Yeah, but okay. Yes, fair. You had to pull the baby card. Can we say, though, that even prior to this baby, you may have some phone habits that could use potential adjustment?
Sure.
If we're just listening to the science.
Yeah.
Okay. All right. Agree. So that was the big one. Get the phone out of the room an hour before bed. That makes sense, right? I think everyone now has heard about like the effect blue light can cause on.
But we've got our fancy blue light
brain.
glasses that we like to wear.
From Warby Parker, not a sponsor of the show, but we do love your glasses. So yeah, we use those. I actually feel like they help.
I actually do too. Like I don't want to keep my contacts in when we're watching TV anymore.
Yeah.
I always put my glasses on.
But why is that? Because you feel like the blue light blocking is working?
I think because our brains are so powerful that, like she said, we have powerful brains.
Yeah.
Especially you. That I think that it's helping me go to sleep. Well, no, I say that Kenny can sometimes trick himself into either being sick or.
Oh, wow. The gloves have officially come off.
Powerful brain.
I don't know if we're going to make it through the end of this segment.
It's the opposite of the placebo effect.
I will say, though, I don't care if it's a placebo effect.
If it works, it works.
Yeah.
Yeah, I don't
care.
Either.
Give me sugar pills all day.
Yeah.
I don't mind.
I'd prefer it.
Yeah. Less harmful on the liver. So, okay. Blue light blocking glasses. That's an us tip, not a her tip. Something else I thought was interesting is if you are having trouble sleeping, like if you're someone who really has insomnia, like of course, see a doctor. But she does not recommend taking pills, which I think we probably could have assumed, right?
Right.
I think, a lot of people are coming to the realization that Americans are over medicated. But what she recommends is actually trying to stay awake for longer until your body naturally wants to go to sleep.
Yeah.
Which makes sense when you hear it. Mm-hmm. But that's not what I guess what I would have intuitively thought they might instruct you to do.
Yeah. Also, something you already did was when you wake up and you get anxious and can't fall back to sleep, you get out of bed.
I do.
And you usually go downstairs to the kitchen and make a mess.
Well, yes, I do. I do like my midnight bowl of granola. And, quite frankly, sometimes I just like a little me time. So in the middle of the night, I sneak out, I watch on TV. No one's hurt by that. But yeah, I do that. And I actually got that from one of the books that I read on sleep.
Yeah.
That might have been like Nick Littlehale's book. I think it's actually just called Sleep. Anyway, that actually does work for me. But I usually go down and watch TV. I think next time I'll try and read a book.
Yeah.
And see if that helps me fall asleep a little bit faster.
You were just saying how your Ulysses S. Grant book makes you want to go right to sleep.
It does. It is so good that it puts me right to sleep. The other thing is she still recommends like thinking about it in terms of like the amount of hours that you need, right? So you and I've kind of been all jazzed up on sleep cycles.
Yeah.
Which I think she didn't say that was bad. I think she might have thought I was saying that like I really like track it with like a sleep tracker.
Yeah, I think that's what she was thinking too.
Yeah.
Because then she started talking about in-home devices, and we don't even have one of those watches or whatever.
And I wasn't even polite enough to just correct her on the spot.
You were confused.
I was just trying to keep up. She's so smart. Yeah. So, okay. So yeah, 7 to 8 hours. Right. But I think that's kind of what we're doing. Like we shoot at least to get 8, hoping that we can get in those 5 cycles.
I mean, we were going to bed at 8:30 for most of the last half of last year.
Yeah. Well, 8:30. Well, we were falling asleep by like 9:30, 10.
Oh yeah, I was asleep much earlier.
Yeah, you were
usually.
asleep earlier. That's true.
But I was also waking up every hour or so to go pee.
That's true. Oh, do you hear that tiny violin? Is there a tiny violin in the room? It must just be in my headphones. So the other thing is people who like to like talk about how little sleep they get, they like to wear it like a badge of honor. There is that like small percentage of the population who actually only needs like somewhere around 4 hours of sleep, right? I think what did she call them? She called them short sleepers. She said that there's actually only 2% of the population that fall within that category. So if you're listening to this and you think you're a short sleeper,
You're probably not.
there's a 98% chance that you are a liar. So odds are you need the 7.5.
Did you write that joke down so that you could say it?
Yeah, I've had that one in the holster from the moment she said it.
Is it written out like that?
No, it's not. But there's shorthand. The other thing too is like consistency over time, and I feel like we do pretty well about this with this now.
Yeah, having kids has definitely helped us.
Yeah, because no one wants to hang out with us in the evening. We don't get invited to anything.
Yeah.
And even if we do, we usually decline because we can't stay up past 10.
Yeah.
So
And our parent friends
yeah,
are in the same boat.
yes, yeah, they're on top of it. We're just trying to keep up with them. One thing I wanted to get your take on, a little controversial, perhaps. The idea that it is okay for couples to
have separate beds.
Separate beds.
How did I know you were going to say that?
Well, because
If anyone would want a separate bed in our relationship, it should be me.
oh, hot take. Please continue. Tell me why.
I don't ever snore. You sometimes snore.
Okay.
Usually no.
I wasn't aware of this. Am I a bad snorer?
No, only sometimes.
Oh, that reminds me. And this was not brought up on the podcast, but this is a Ken pro tip.
Oh God, I know exactly what you're going to say.
Yeah, you know where this is going. I started sleeping with max strength breathe right strips
Yes,
because
you
I
did.
have a deviated septum. Because I've broken my nose on a number of occasions. And I don't breathe well through it, especially in the winter. I get a little congested.
Yeah,
The
he
breathe right
does.
strip keeps that wide open. We'll link to that in the show notes. And so that's a pro tip. But yes, okay. The idea of couples sleeping completely separate,
Yeah, I don't like that.
no dice.
Yeah, I don't like that.
Did you get my Dick Van Dyke reference?
Yeah, with the separate beds.
Yeah.
Yeah,
Did you enjoy it?
yeah, it was good.
Okay. I'm doing this entire podcast for you. Okay. So
That's not true, because if you were, one, you would have answered or asked my mom's question
No.
about menopause. And two, probably more importantly, you would have asked how to make our babies.
wow. How to make the baby? Well, I mean, okay. It's not. There's a lot of questions that I would love to ask her. We're gonna have to have her back on.
Yeah.
Just pick her brain. I feel like I could have kept asking her questions for hours. You know what I
Yeah.
mean? Like she's doing so much interesting stuff with couples, with the military, and just sleep in general. And yes, I'm sorry, menopause was on the list. We will have to follow up on
Yeah,
that
my
one.
mom's really upset at you.
Wow. I mean, I don't know.
She doesn't ask for much, Kenny.
I'll get her on the next one. Okay, but that's kind of all the takeaways I had. So I think, the big thing was get a routine, get the phone out of the room, right? And if you're trying to have sleep, don't resort to melatonin, Benadryl if you don't have to. You know what I mean? Maybe try this idea of extending your wakefulness. See if that works for you. I think that's everything. Do you have anything?
No, I think we covered it all.
That feels like a good, I know. I got to make these more concise.
Yeah.
Maybe the plan is to boil it down to like 3 takeaways.
Yeah.
Because people are like, did I just listen to the podcast over again? Like, what is this section?
and them kind of fight with each other.
Yeah, it's like it's like the same conversation, just a little more chippy.
Yeah.
Okay, well, we'll work on it. This thing's a work in progress.
It's only our 3rd time.
Come on, we're getting better people. All right, well, hey, if you haven't turned off the show yet, thank you for listening. We've got a really great show next week, and I'm going to edit in who that is because I'm forgetting right now. All right, everybody. Thank you for listening. We'll see you next week.
I love you.